Well, we're very happy to report that our friend, colleague, and regular on this program, Dr. Kevin Kavanagh, is back in the pink. I don't think he's going back to playing hockey anytime soon, but anyway, he is a retired physician and also the founder and president of a national organization called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
No hockey, right?
No hockey today, no, but I am up and chipper, so that's good.
Tell me what's new in terms of COVID-19.
Well, the biggest thing is the CDC has released a study which strongly indicates that immunity from 2 vaccines or 2 jabs is stronger than natural immunity. And this is a relatively large study where they looked at individuals who came into the hospital with symptoms suggestive of COVID or that they were worried that they had COVID. And if they were vaccinated and did not have a previous infection, there was only 1/5 the chance that they would have COVID-19 compared to someone who had a previous infection. In other words, previous infection, 5 times the chances of getting COVID compared to someone with a previous vaccine. And so that is really significant, and I hope encourages people to go out and get vaccinated even if you've had an infection. And of course, right now, the CDC is considering changing the definition of full vaccination to actually 3, not 2, but 3 doses of the mRNA vaccine. Another study out of Nature, this looked at super immunity. And apparently, if you've had a COVID-19 infection and then receive an mRNA vaccine, you get a whole plethora of different types of antibodies that even enable you to fight off coronaviruses that maybe not even have been devised yet. In other words, really broad types of immunity, and you become super immune. Again, another reason to get a vaccine if you've had a previous infection. And most studies, in fact, all that I have read, show that immunity wanes whether or not you've had a vaccine or whether or not you've had a natural infection, and a vaccine will help. And of course, if you've had the vaccine and immunity wanes, you just get a booster. If you've had a natural infection, you need to go on ahead and get the vaccine.
And this is also a big week in terms of the vaccine for younger kids. Shots for younger kids could become a reality this week if approved by the CDC, correct?
That's correct, and I would strongly suggest that people go on ahead and get this for their children. We're doing that for our grandchildren. It needs to be remembered that as of today, that over 24,000 individuals have been hospitalized with COVID-19 that are children. In other words, children have been hospitalized. There are about, I would say, 2% of everybody who is a child who develops COVID-19 that unfortunately winds up in the hospital. And the rate of long COVID in individuals who are children that are hospitalized is up to 14%. And the chances of getting an infection when you're a child is quite high. Right now, 24% of COVID-19 cases are in children. So all of this is very concerning. Children do get this disease. It is a very serious disease. They can become very sick. They can become hospitalized. And I would strongly recommend that parents should look at and talk to their doctor about getting a vaccination. I think that is the way to go.
And of course, the New York City vaccine mandate for city workers will be enforced starting today. This is a big story. Many are bracing for possible staffing shortages in the city's police, fire, and sanitation departments. As a result, this mandate does not allow for a testing option. That is one part of the mandate that I don't understand. It seems to me that we could remain just as safe, eliminate the mandate, and require, if you don't get a vaccine, require them be tested every week or whatever.
Well, it's actually more the whatever. To have that have any impact, it has to be about 3 times a week. It is expensive. It's hard to coordinate. And it's not as for sure. In other words, it has a false positive, false negative rate. So it's not as for sure as just getting vaccinated. And the thing of it is with frontline workers, they're up with the public all the time. If I'm pulled over in a car by a policeman, I would like to have that policeman vaccinated. And right now, from what I understand, the chances of a policeman dying of COVID are higher than the chances of them getting shot. So I really think that they need to get vaccinated. All of our frontline workers do. This is a national security issue. Jack, we've talked about that on Friday. I think that in all likelihood that this virus is very, very infectious, very deadly, and it quite possibly was, made in a lab. And if that's the case, this is something we need to react to and be proactive, not sit around and just let it infect us. So I think following public health advice, getting vaccinations are key. Testing is a big part of this, but vaccinations, I think, is the way to go.
All right. Always a pleasure. Thank you so much.
All right. Thank you very much, Jack. Bye.